Hi, and welcome to Central Care TV, where we keep you up to date with the latest happenings in Houston. March is Colorectal Cancer Awareness Month. Among cancers that affect both men and women, colorectal cancer, which is the cancer of colon or rectum, is the second leading cause of cancer deaths in the United States. Every year, about 140,000 Americans are diagnosed with colorectal cancer, and more than 50,000 people die from it. But this disease is highly preventable by getting screened beginning at age 50. Screening tests help prevent colorectal cancer by finding precancerous polyps, or abnormal growths, so they can be removed. Screening also finds this cancer early when treatment can be most effective. If you're aged 50 to 75, get screened for colorectal cancer regularly. If you're between 76 and 85, ask your doctor if you should be screened. Be physically active. Maintain a healthy weight. Don't drink too much alcohol. And don't smoke. Here are some facts about colorectal cancer. Risk increases with age. More than 90% of colorectal cancers occur in people aged 50 and older. Precancerous polyps and colorectal cancer don't always cause symptoms, especially at first. You can have polyps or colorectal cancer and not know it. Some symptoms may include blood in or on the stool, stomach pains, aches or cramps that do not go away, losing weight and you don't know why. Some people are at a higher risk than others for developing colorectal cancer. If you think you may be at high risk, talk to your doctor about when and how often to get tested. To help you spring into action regarding your wellness, and in honor of March being National Nutrition Month, here's some information about our new state-of-the-art fitness facility. Our fitness facility offers various health and wellness options. Some classes include chair aerobics, line dancing, Zumba, step aerobics, and yoga. Additional services include dance studio available for rent, weight room, treadmills, ellipticals, exercise bikes, healthy vending machine, and fresh fruit and water available daily for free. Here are the hours of operation. Also, here are 8 ways to celebrate National Nutrition Month. Make a plan. Create a plan you can follow every day. Plan your meals, exercise routine, and even trips to the grocery store. Not only will it help you stay on track, but it will lessen your stress load. Keep healthy foods in the kitchen. Doing so makes eating plenty of fruits and vegetables a lot easier. Fit in fruit and vegetables. It's one thing to stock up on fruits and vegetables, and it's another to eat them before they shrivel and go brown. Sneak vegetables into unlikely dishes, or kick off your brown bag lunch with fruits and vegetables before you dig into the main dish. Load up early, go light later. Americans tend to eat a light breakfast or skip it, grab lunch on the run, and eat the bulk of the calories from dinner or through the evening. If your mornings are too rushed, try to fuel up at lunch. If you don't have time for a big breakfast, chow down on a big, healthy lunch. This will help you shrink your dinner and limit evening snacking. Have snacks ready. It can be hard to hunt down healthful snacks on the go, so bring your own. De-stress the 6 o'clock scramble. The nightly question, what's for dinner, begs for a quick and easy answer. The key is advanced thinking. Keep a go-to list of family favorite dinners next to the fridge, or freeze portion-controlled single servings so all you have to do is pop them in the microwave to defrost. Satisfy, don't deprive. Practice a 90-10 approach. Choose healthy foods 90% of the time, and leave 10% wiggle room for celebrations, restaurant meals, and sweets. And earn your calories. Maintaining a healthy weight depends on burning sufficient calories too. In addition to planning out meals and practicing portion control, fit physical activity into your hectic lives in different ways depending on the season.
Welcome to CentraCare Integrated Health Services. We are the oldest health center of our kind in Houston, Texas, and are located at 6 convenient locations around the city. Our network of community health care centers provide primary and preventative medical care, a full-service dental program, wellness programs, and other resources for your entire family. We see patients of all ages. Ability to pay is not a factor, whether you are insured or uninsured. We would love for you to become a part of our CentraCare family. Check out our website or give us a call to learn more about us. Today, we would like to introduce you to a free program we offer called Five Alive. With just 5 minutes of your time, you will receive 5 tests that will give you an overall picture of your health. Five Alive will check for diabetes, hypertension, high cholesterol, obesity, and HIV. Let us walk you through the process of receiving your free Five Alive test. The first test we will cover is the test for diabetes. Diabetes is an illness that occurs when your body does not produce enough insulin, which is a hormone necessary for regulating your body. Some symptoms of diabetes include excessive thirst, hunger or urination, extreme fatigue, and blurry vision. People who suffer from diabetes are at risk for long-term problems with their eyes, heart, kidneys, and nerves. The test involves a finger prick, which feels like a strong pinch. Next, we will cover hypertension, also known as high blood pressure. Some causes of this condition include smoking, too much salt in your diet, stress, lack of exercise, and family history. Sometimes you will not have any symptoms with hypertension, but you may experience headache, weakness, vision problems, or chest pain. The test for hypertension involves gentle pressure around your arm and is painless. Our next test checks for high cholesterol. Cholesterol is natural in your body, and it helps produce hormones and assists with digesting your food. Too much cholesterol, however, gives you problems with your heart, including possible heart attack. This condition does not usually cause symptoms, which is why it's very important for you to be tested. This test also involves a finger prick, which feels like a strong pinch. Obesity is defined as having an amount of body fat that puts your health at risk. This test involves calculation of your BMI, or body mass index, which is measured by your height and weight. HIV is a virus found in certain bodily fluids. The virus weakens your immune system. There is no cure, but with proper medication, it can be managed like other chronic illnesses. As with high cholesterol, this virus does not usually cause symptoms, which is why it's important for you to get tested. This test, too, involves a finger prick and feels like a strong pinch. And that completes our Five Alive program. Remember, with just 5 minutes of your time, you can receive these 5 tests free. Get an overall picture of your health. If you're interested, be sure to check us out online or give us a call to learn more.
National Women and Girls HIV and AIDS Awareness Day falls on March. National Women and Girls HIV and AIDS Awareness Day is an annual observance that sheds light on the impact of HIV and AIDS on women and girls. Every year on March 10th and throughout the month of March, national and community organizations come together to show support for women and girls impacted by HIV and AIDS. Today, about 1 in 4 people living with HIV in the United States is female. Only about half of women living with HIV are getting care, and only 4 in 10 of them have the virus under control. Whether you're actively dating or are in a committed relationship, you can take these simple, effective steps to help prevent HIV infection for you and your partner. Use condoms every time you have sex. Get an HIV test, which is free and confidential. Be monogamous. Do not abuse alcohol or drugs. Talk to your doctor if you think you're at risk for HIV. Many people who are HIV positive do not have symptoms of HIV infection. Sometimes people living with HIV go through periods of being sick and then feel fine. Some people experience a flu-like illness, develop a rash, or get swollen glands for a brief period soon after they become infected with HIV. AIDS stands for Acquired Immunodeficiency Syndrome, the end result of HIV infection when your body is no longer able to fight off other infections. Symptoms can include rapid weight loss, reoccurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, sores of the mouth, anus, or genitals, pneumonia, red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids, memory loss, depression, and other neurologic disorders. The only way to know for sure if you have HIV is to get tested. Remember, Central Care offers HIV testing, which is included in our 5 Alive health screening program. The 5 Alive health screening program will check for diabetes, hypertension, high cholesterol, obesity, and HIV. Be sure to give us a call to learn more.
My name is Vernon Lemon, and I think that what they're doing is a very good thing, and I think it helps them out for people that are having hard times like these during the holidays and stuff like this, where they can't afford to buy this. And I think it's good that they do drives to help give people what they need and stuff like this, and whatever care that they need too also. Just the last couple of like 3-4 months I've been coming. The ones that I've met here at Central Care are very, very nice. They're very caring. I think what they do is great in helping with the project that they do. And the friend that works here I know does a lot of work in helping out with this, plus doing other stuff too, to help clients with what they need. And yes, I did get the test done, the blood pressure and the sugar test done, and it was free. There was no charge for that, and it was very well and good.
I think it's good to have the Central Care in the community for the people, because you have a lot of people in the community that does not have transportation, and it's easy access, easy for them to get, to get to the doctor. Well, my sister's name is Rose Roach. Everybody up here knows her. The doctors have been real helpful to her. She gets her mammograms through this clinic, and all her healthcare services. I think it's very nice that they're doing this for the community, because we have a lot of poor people in the community that cannot provide food for their families, like during the holidays, and this helps them out. And it's everything that they're giving nutritious foods to the people. And we thank you for your services, because it's a big help.